And as someone with a child who is currently sporting his third set of ear tubes, my first guest today speaking on a topic that I know something about, and that is earaches in our kids. And it turns out that there are a few causes and thankfully solutions that can really ease their pain and your concerns. So here with more, always happy to have Dr. Evan Tobin with Ohio ENT and Allergy Physicians on with us. Good to see you, Dr. Tobin.
Good to see you. Thank you for having us.
All right, absolutely. And I know, we talk about it a lot because I am not alone in this. This whole, having your kid deal with ear pain, the constant kind of figuring out what's causing it and how to help them. That is something so many people see, right?
Right,
yeah.
right, yeah. This time of year is kind of a transition time of year. We're getting out of swim season. We're getting into cold season. Kids are back in school. And so your kiddo comes home with an earache and, what is it? Is it a swimmer's ear because they're still swimming, or maybe you just came back from the beach, or colds are out there now, and is it a middle ear infection? And so it's kind of helpful to differentiate these two and talk about things that can help us to figure out the right diagnosis.
Okay, so then let's start with the swimmer's ear maybe.
Yeah.
And my kids still take swimming lessons, right? They're still in the water if it's not just at the pool every day in the summer. So those things are going to happen all the time as well. So how do you know that that's the cause?
Right, yeah. So usually there will be a history of a lot of water in the ears, maybe swim school or a trip to the beach. It's a painful infection, and what's different about a middle ear infection is it hurts to touch. If you push on the flap in front of the ear, it hurts a lot. If the urgent care or the pediatrician even tries to look in the ear, you jump off the chair, which is different than a middle ear infection. And first thing is, wax is good. It's always worth saying that. We want to have some ear wax in, and Q-tips, I realize a lot of people use Q-tips whole life, never had a problem, but for most people, they're not good. They either push wax in or take out too much wax, or worse, abrade the skin, and then water can get in and irritate the skin, and then the bacteria that are on the surface of the skin get in and cause infection, and immediately beneath this fragile skin of the ear canal is bone and cartilage, and that's why these infections hurt so much.
Yeah, and so when you figure out if it's swimmer's ear, how do you handle those? Is it the same, an antibiotic kind of drop?
It's an ear. It is the same as the drop that you mentioned, but we're treating the skin, and it's usually just an antibiotic. Sometimes it's an antibiotic with a steroid in it. They're by prescription. They could be over the counter, but they're by prescription, and so the urgent care is going to make the diagnosis. And if there's enough infection, trapped material, pus, if you will, then they may send you to the ENT to clean the ear.
Okay.
Which can be very important, because if the drops can't get in, they can't work. And then we want to try to keep the ear dry. How can you prevent swimmer's ear infections? Swimmer's ear drops can help if you don't have ear tubes and you don't have a hole in your eardrum, because then those drops will hurt. But those are alcohol, and they basically dry and disinfect the ear.
Right, those are a drying agent. So then you're saying when you've got the tubes, you've got a hole in your ear, that's going to do the opposite. It's not going to help.
If you happen to be a mom of a child who has ear tubes, or maybe there's a hole in the eardrum, stay away from swimmer's ear drops, because they'll hurt a lot.
A lot.
Yeah.
Okay, so if we move to the middle ear, or something that may be from a cold or a virus, something that led to an ear infection, is that typically what we see, especially transitioning into the back to school fall kind of time?
And so two peaks, two age groups. It's babies whose immune systems are still developing, and their anatomy, their eustachian tube is still developing. A cold, an airline trip, something that changes the pressure leads to fluid that collects behind the middle ear, and that fluid is a problem because it diminishes the hearing, but if it stays there long enough, it gets infected with bacteria that usually find their way up from the throat, and then that's another painful infection, but it doesn't hurt to manipulate the ear. Child might have a low-grade fever, they're tugging, sometimes tearful, and that's usually a pretty straightforward diagnosis by a pediatrician. And then it's an oral antibiotic, and it can be multiple rounds of antibiotics, but if they become recurrent, then we get into a situation that you know very well with your kiddos.
Very well, and they have to have a certain number throughout the year to qualify for that typically, because it is something where you see them grow out of it sometimes, right? And they can kind of get to a point where everything's working as it should.
Yeah. They can grow out of it as their eustachian tube and immune system develop, but then there's a second peak, 3 and 4, 5-year-olds, as their tonsils and adenoids get big. The adenoids are located right at the back of the eustachian tube, and so these kids are stuffy, mouth breathing, snoring, and sometimes will have middle ear fluid and get recurrent infections. And so that's the second peak. And again, All of these kids can benefit by ear tubes. The older kids might benefit by removal of the adenoids.
Okay. Yeah, we've had those twice as well.
Yeah.
Look at that. I'm a pro in all.
But
I've been to your
I know
office
your
more times
doctor,
than
and
you know.
he's excellent.
Our doctor is excellent. Yeah,
Yes.
Dr. O'Brien.
Yeah.
So I just want to let people know too, it is something where kids we know get ear infections a lot, but adults we don't tend to get as many, but there are situations, right, for ear pain that you should not ignore and maybe see an ENT.
That's right, yeah. So adults can get swimmer's ear infections. Sometimes they get really good at cleaning their ears with Q-tips. They can get middle ear infections after a cold or airline travel, but less likely. And so we want to investigate ear pain in adults because it can be something else. It can be a sinus problem. It can be a jaw joint problem from clenching and grinding.
Yeah.
But rarely can be some bad things too, because tumors and cancers can start in the throat and present with ear pain. And so adults with ear pain that doesn't get better, they need to be checked.
You've got to check it out.
Yeah.
And I want to say we were discussing, I'm leaving, NBC for it next week. I have interviewed you and your team for years, and it has always been a pleasure. I will not, be far because I'll probably be in your office every 6 months getting my son checked.
Place, yeah.
But it has been a pleasure, and I want to thank you guys.
Us too, and you have helped us teach a lot of people about these problems, and we appreciate that.
Yeah, absolutely. My pleasure. Well, Dr. Tobin, Ohio ENT and allergy physicians, thank you.
Thank you.